For decades, fat was treated like the enemy of good health. Low-fat everything lined the grocery store shelves. People believed that eating fat meant gaining fat. The science has moved well past that idea, and understanding what it actually says can change how you think about food. Dietary fat is not optional. Your body needs it. Fat helps you absorb vitamins A, D, E, and K, the fat-soluble vitamins your body cannot use without it. Fat supports brain function and hormone production. And critically, fat slows down how quickly food leaves your stomach, which means you stay full longer after a meal. When you cut fat out completely, you often feel hungrier, more tired, and nutritionally shortchanged. The important distinction is type. Not all fats work the same way in your body. Unsaturated fats are the ones most health guidelines point to as beneficial. You find them in olive oil, avocados, nuts, and seeds. These fats support heart health and help reduce inflammation. Two things that matter a great deal for metabolic health overall. Omega-3 fatty acids are a specific type of unsaturated fat worth highlighting. The National Institutes of Health Office of Dietary Supplements recognizes omega-3s for their role in supporting both heart and brain health. Fatty fish like salmon and sardines, along with walnuts and flax seeds, are good sources. Saturated fats, found in butter, full-fat dairy, and fatty cuts of red meat, are worth moderating. The American Heart Association recommends keeping saturated fat to no more than 5 to 6% of your total daily intake, because higher amounts are associated with elevated LDL cholesterol levels. Then there are trans fats. These are the ones virtually every major health authority agrees you should avoid. Trans fats raise harmful cholesterol and lower protective cholesterol at the same time. The FDA has largely banned artificial trans fats in the United States, but it still pays to check food labels for the phrase partially hydrogenated oils. That is another name for the same thing. One nuance worth knowing: fat is calorie dense. It contains roughly twice the calories per gram compared to protein or carbohydrate. That means portion awareness still matters, even with the healthiest sources. A small amount delivers real benefit. You do not need large quantities to get the effect. Some research also suggests that swapping refined carbohydrates for healthy fats may help stabilize blood sugar levels throughout the day, which can reduce energy crashes and make it easier to sustain consistent eating habits over time. Practical changes do not have to be dramatic. Cooking with olive oil instead of butter, adding a handful of walnuts to a meal, choosing salmon over a processed option. These are small, sustainable shifts that support healthier metabolic markers without requiring a complete dietary overhaul. Your specific needs depend on your health history, your current lab values, and other individual factors. A licensed clinician can help you build a fat strategy that fits your situation. If you are in California or Nevada, you can connect with a provider at sendslim.com. Check there for current availability.